Assalamu alaikum. Hello my dear students, hope you are doing good. I am Dr. Karim Rezwan Hasan, Associate Professor, Department of Anatomy, Ad-Din Women's Medical College, Dhaka. Today I will discuss about the posterior compartment of the thigh and popliteal fossa. In the previous classes, I have discussed about the anterior compartment of the thigh, femoral triangle and the clinical condition related to the femoral triangle like the femoral hernia. Today I will talk about the posterior compartment. We will discuss about all the muscles which are present in the posterior compartment along with their origin, insertion, nerve supply, actions and everything. Not only that, we also discuss about the popliteal fossa, a very important fossa that is present at the posterior aspect of the knee joint. So let's begin with the cutaneous innervation of the posterior compartment of the thigh. Let's see the slide. In this slide, you can see the cutaneous innervation of the posterior compartment of the thigh. Easily speaking, it is having three branches. The medial cutaneous nerve of the thigh at the medial side, as you can see over here. Then at the posterior cutaneous nerve, which is present at the very posterior aspect of the thigh, and also the lateral cutaneous nerve. So medial cutaneous, posterior cutaneous and the lateral cutaneous nerve of the thigh. Now the superficial vein. Many small veins curve around the medial and the lateral aspect of the thigh, drain into the great saphenous vein. Superficial vein from the lower part of the back of the thigh join the small saphenous vein in the popliteal fossa. Lymphatic drainage. Lymph vessels from the skin, superficial fascia on the back of the thigh drains upwards and forward into the vertical group of superficial inguinal lymph node. Now, what are the main muscles of the posterior compartment of the thigh? In the posterior compartment of the thigh, the muscles are also known as the hamstring muscles. The word hamstring comes from the ham and the string, where the ham means the muscles which if accidentally cut or if you cut the muscles, then the person will be crippled. That means the person cannot work properly. At the same time, these muscles are the very strong muscles which are helping for the walking, running and every sorts of movement of the lower limb. Hamstring muscles are also very much important for the sports medicine because hamstring injury is very common in the sports like football, rugby and other kind of stressful sports. Now, in the hamstring muscles, there are basically four muscles. The muscles are biceps femoris, semitendinosus, semimembranosus, ischial part of the adductor magnus. The blood supply of this posterior compartment is branches of the profunda femoris artery, which is the largest branch of the femoral artery, and the nerve supply is sciatic nerve, the thickest nerve of our body. Now in this picture we can see the muscles which are the hamstring muscles or the main muscles of the posterior compartment. Here we can see the biceps femoris, then we can see the semitendinosus muscle, and semitendinosus muscle is resting on a very flat muscle which is called the semimembranosus. Not only that, another muscle which is present basically at the adductor compartment called the adductor magnus, it is also having a part which is present at the posterior aspect of the thigh as a hamstring muscle, and that is the ischial part of the adductor magnus. So now let's start with the muscles with their origin, insertion, nerve supply and action. We will start with the biceps femoris. You can see the biceps femoris, the long head is coming from the lower medial part of the upper area of the ischial tuberosity, and the short head is coming from the lower part of the linea aspera and the lateral supracondylar ridge of the femur. The insertion is happening at the head of the fibula, actually at the styloid process of the fibula. The nerve supply is the sciatic nerve. The action is flexion and the lateral rotation of the leg, and the long head actually doing the extension of the thigh. You can see this is the origin point and this is the insertion point. And it is having two heads. We can see the long head and the short head. The long head is coming from the ischial tuberosity and the short head is coming from the linea aspera. Now this is a picture where you can see the origin of the biceps femoris muscle from the ischial spine, this purple color area along with the semitendinosus, and we can also see the insertion is happening in the fibula styloid process. Now the semitendinosus, the origin lower medial part of the upper area of the ischial tuberosity with the long head of the biceps femoris. Insertion is happening in the upper part of the medial surface of the shaft of the tibia behind the sartorius and the gracilis. As you know that semitendinosus is a part of the guide ropes. The nerve supply is the sciatic nerve, the action is the flexion and the medial rotation of the leg and the extension of the thigh. Now the semimembranosus. The origin is coming from the upper lateral part of the upper area of the ischial tuberosity, and the insertion is happening at the posterior medial surface of the medial condyle of the tibia. The nerve supply is as usual sciatic nerve, the action is the flexion and the medial rotation of the leg and the extension of the thigh. In this picture we can see both semitendinosus over here and the semimembranosus as well. The semitendinosus is called semitendinosus because almost half of this muscle is tendinous. On the other hand, the semimembranosus is called the semimembranosus just because half of the muscle is membrane-like. Now, the ischial part of the adductor magnus. The origin is from the lateral part of the lower area of the ischial tuberosity, and the insertion is the adductor tubercle of the femur. The nerve supply is the sciatic nerve and the action is the extension of the thigh. Now what about the blood supply of these muscles? You know that the posterior compartment bears all of the largest branch of the femoral artery, that is the profunda femoris artery. So profunda femoris artery will be the main source of artery supply of the posterior compartment muscles. So 4 perforating branches of the profunda femoris artery provide a rich blood supply to the posterior compartment of the thigh. The profunda femoris vein drain the greater part of the blood from this compartment. Nerve supply. As you know, the sciatic nerve after its formation is passing through the posterior compartment of the thigh. Later on, at the popliteal region, it will be divided into tibial nerve and the common peroneal nerve. So before doing that, the sciatic nerve gives numerous muscular branches to the posterior compartment thigh muscles. The sciatic nerve is branch of the sacral plexus. The root value is the number 4, 5, sacral 1, 2, 3, leaves the gluteal region as it descends in the midline of the thigh. In the lower third of the thigh, it ends by dividing into tibial and the common peroneal nerves. It gives muscular branches to the long head of the biceps femoris, the semitendinosus, the semimembranosus, and the hamstring part of the adductor magnus. These branches arises from the tibial component of the sciatic nerve and run medially to the muscles. The short head of the biceps femoris is mainly supplied by the branches arising from the common peroneal nerve. Sometimes it has been said that the peculiarity of the nerve supply of the biceps femoris. You know that the biceps femoris is having 2 heads, long head and the short head. The long head is getting nerve supply from the tibial part of the sciatic nerve. On the other hand, the short head is having nerve supply from the common peroneal division of the sciatic nerve. Now in this picture we can see the sciatic nerve is arising from the lumbar 4 to sacral 3, and then it crosses the pelvic region by passing through the greater sciatic foramen and it descends down in the posterior compartment of the thigh. Then in the popliteal region it is dividing into tibial nerve which is passing vertically downwards, but the common peroneal nerve it is going laterally and it winds down the neck of the fibula. So these are the branches of the sciatic nerve in the different compartment of the lower limb, the muscular branches, and also we can see the articular branches as well. Now we will discuss about the popliteal fossa. Popliteal fossa is one of the important topic for your examination because the commonest question is give me the boundary, contents and the clinical importance of the popliteal fossa. Also the step of dissections. Popliteal fossa is important in that sense because it is an ideal question for the professional examination and teachers always prefer to give this question. Not only that, it has some particular type of drawing. So you have to be very much careful whenever you are focusing on the popliteal fossa. Let's see the popliteal fossa. Boundary of the popliteal fossa. Upper laterally it is bounded by the biceps femoris. Upper medially it is bounded by the semimembranosus and the semitendinosus. As in this picture you can see, this is the biceps femoris muscle present upper laterally, and upper medially it is bounded by this tendinous semitendinosus muscle and underlying the semimembranosus muscle. At the lower medially it is bounded by the medial head of the gastrocnemius over here, this blue color area. At the same time, lower laterally it is bounded by the lateral head of the gastrocnemius associated with the plantaris. Now what is the roof? You know that the roof starts from the skin, then the superficial fascia that will contain the superficial cutaneous vessels and nerve, then the small saphenous vein, terminal part of the posterior cutaneous nerve of the thigh, posterior division of the medial cutaneous nerve of the thigh, the sural nerve and the popliteal fascia or the deep fascia of the popliteal region. In this picture, we can see the contents of the roof. You can see the posterior division of the medial cutaneous nerve of the thigh, then posterior cutaneous nerve of the thigh, then short saphenous vein or lesser saphenous vein, and the sural communicating nerve. We can also see this area is covered by the fascia that is called the popliteal fossa. Now the floor is formed above downwards by the popliteal surface of the femur. We can see over here the capsule of the knee joint, which is the joint capsule, and the oblique popliteal ligament, and then the popliteus muscle. We can see this is the oblique popliteal ligament and this is the popliteus muscle, which is present obliquely in the popliteal region. Remember, the popliteal muscle is having the tendinous origin and muscular insertion. Now let's see the main muscle of the popliteal region, that is the popliteus muscle. The popliteus muscle is very much peculiar for its certain characteristics. You know that the popliteus muscle is one of the unlocking muscle, that is its first criteria. Then also most of the muscles is having muscular origin and tendinous insertion. But in case of popliteus muscle, it is having tendinous origin and the muscular insertion. Not only that, its origin is intracapsular. You know that the origin of the popliteus muscle is tendinous, and that tendinous head is present within the joint capsule of the knee joint. So that is another peculiarity. Also, this is the only muscle which is doing the unlocking of the knee joint. That means whenever you try to bend your knee from the standing or the upright position, this is the first muscle which will trigger the unlocking mechanism. Now let's see the origin, insertion and the nerve supply action of the popliteus muscle. The origin is coming from the tendon, which is the anterior end of the popliteal groove, the lateral femoral condyle. So that condyle is having a popliteal groove, as we have discussed during the study of the femur. So we know that from that groove the tendon of the popliteus muscle is arising. This tendon passes under the lateral collateral ligament of the knee. Then the insertion is happening in the knee capsule under the arcuate popliteal ligament. Also, the triangular area at the posterior surface of the tibia at its upper end above the soleal line. It gives also insertion to the knee joint capsule and lateral meniscus. Now in this picture, we can see that the popliteus muscle is obliquely placed. This is the origin and this is the insertion. Not only that, we can see that the popliteal ligament is also coming from the tendon of the popliteus. You can see the popliteus head or origin is within the joint capsule of the knee joint, which is a very peculiar characteristics of the popliteus muscle. The nerve supply of the popliteus is tibial nerve, and this muscle, as I said, is the main unlocking muscle of the knee joint. It unlocks the knee when we start flexion. It retracts the lateral meniscus during the flexion. You know, the lateral meniscus is commonly injured meniscus in our knee joint. Now, what are the contents of the popliteal fossa? The contents of the popliteal fossa are popliteal artery, which is the direct continuation of the femoral artery with its branches, the popliteal vein, which will drain into the femoral vein, or you can say it will be continuous as a femoral vein. Also, the popliteal lymph node and tibial and the common peroneal nerve with their branches. And popliteal region is also having some fat. This picture showing the contents of the popliteal fossa, we can see this is the tibial nerve, this is the common peroneal nerve, and you can see the popliteal vein just underlying the tibial nerve, and most deeply seated popliteal artery. These are the popliteal lymph nodes, and these are supported by fibrofatty tissue over here. Now popliteal artery. Popliteal artery begins as a continuation of the femoral artery at the adductor magnus hiatus. It terminates by dividing into anterior and the posterior tibial artery at the lower border of the popliteus muscle. In this picture, we can see the popliteal artery is coming as a continuation of the femoral artery, and over here it is dividing into anterior tibial artery that is going anterior aspect of the interosseous membrane, and the posterior tibial artery, which is going at the posterior aspect. Not only that, from the posterior tibial artery, a fibular artery is also coming. Popliteal artery course, it is deepest of the structure of the popliteal fossa. It lies medial to the popliteal vein and tibial nerve at its initial course, then deep to them in its middle, and later it will be lateral to them. The branches are superior, inferior, middle genicular arteries and muscular branches or the sural branches. Let's see a picture. You can see popliteal artery is giving branches, superior lateral genicular branches, superior medial genicular branch, middle genicular branch and inferior genicular branch. Then the popliteal vein. The formation, popliteal vein is formed by the union of the anterior and the posterior tibial vein near the lower border of the popliteus muscle. It will be terminated through the adductor magnus hiatus and go ultimately into the adductor canal, and ultimately it will continue as femoral vein. In this picture we can see the popliteal vein is formed by the anterior and the posterior tibial vein, and then it will cross the knee, and then it will continue as a femoral vein over here. Now the course of the popliteal vein, along its course it lies between the popliteal artery and the tibial nerve, as we have already seen. The tributaries are the vein that accompanying the branches of the popliteal artery and also a small saphenous vein. Small saphenous vein, it starts from the lateral side of the dorsal venous arch. It ascends behind the lateral malleolus, then it goes upwards in the calf and drain at the lateral side of the foot and the ankle, the back of the leg. It will be terminated by piercing the deep fascia and drain into the popliteal vein. In this picture we can see this is the dorsal venous arch, and from the lateral aspect this is the small saphenous vein that is going through the calf, and in the popliteal region it is piercing the deep fascia and it will be continuous as a femoral vein. Now the popliteal group of lymph nodes. Few lymph nodes just underlying the deep fascia, they are embedded in the fibrofatty tissue of the popliteal fossa close to the popliteal vessels. They drain the deep tissue of the leg, foot and the knee joint, and the efferent of this popliteal lymph node will be into the deep inguinal lymph node. Sciatic nerve. Sciatic nerve leaves the gluteal region to the back of the thigh, midway between the greater trochanter and the ischial tuberosity. It is lying deep to the long head of the biceps femoris, as we can see over here, and ultimately it will be divided into tibial and the common peroneal nerve just above the popliteal fossa. It innervates the muscles of the back of the thigh, has articular branches to the hip and the knee joint as well. So the tibial nerve, which is a branch, terminal branch of the sciatic nerve, is having muscular branches that will give supply to the muscles of the popliteal region, and also the articular branches. That articular branch are present as a 3 genicular nerve and a cutaneous nerve which is called the sural nerve. On the other hand, the common peroneal nerve passes medial to the biceps femoris. As you can see, it is passing just neck of the fibula and going to the lateral aspect, and it will be disappeared into the peroneus longus. It lie at the lateral aspect of the neck of the fibula. The branches, it doesn't give any muscular branch, but it will give 3 genicular nerve as articular branches, and the cutaneous nerves are the sural communicating nerve and the lateral cutaneous nerve of the calf. For your kind information, sural means leg. So my dear students, hope you got all the information regarding the posterior compartment of the thigh and also the popliteal fossa. In the coming class, we will discuss about the step of dissection of these regions with some videos. Till then, take care, stay safe.